time when I felt that I had a complaint about the care, not with the registration, not with the chemo, not with the nurses in, when I was getting the chemo, the secretaries in the chemo department, just, there was everyone. The girls who did the temps and blood pressures, they were absolutely terrific. People know who you are.
I can't say enough how thankful we are, you know, that God helped us live here in Charleston with a hospital like MUSC close that knows what they're doing about things that are random, you know? These random things, they happen, and you want to go somewhere where they're not freaked out by it. And you know, if we had lived somewhere else, they would have sent us to MUSC. So we just felt really very blessed that we were near a place that was of the caliber of doctors and nurses and staff.
Our third child, Samuel, spent 14 months there, so I was well aware of the quality of care at MUSC. I'm also fortunate to have a mother in health care, and in those circles, everyone spoke very highly of the cardiac program at MUSC. A lot of the research says the first thing you need to do is get multiple opinions, consult multiple doctors. And when I would talk to friends in medicine, and my mom's friends in medicine, it kept coming back, you're at MUSC, you're at great hands.
All of them are just fantastic. I'm from the coordinator to the doctors to the nursing staff, every technician, everybody was just wonderful.
I really felt like everybody knew what was going on, knew some of the foibles, knew what my labs were all about, knew what the different things that showed up on an MRI or didn't show up or were in the tissue, and so I didn't have to constantly repeat myself. And that made for a much more cohesive treatment, and made me very comfortable. And I still feel like this is my team, and this is the team that I'm going to be with. And also, as people were making appointments for me, as the physicians were making appointments for me, they would look to see when you were available and try to do it so that it was very convenient. I feel very, very, very good about MUSC.
You hear that there's a big push toward increasing the transplants at the major facilities where they're getting up to 60, 80, or 100 transplants per year. And I felt the quality of care would be better at a program that didn't focus so much on the numbers and focus more on the quality of care. So that was the number one decision, is I felt I'd get the best quality at a program that was focused, you know, on less on numbers and more on outcome. That is what I felt the program here was about.
Are we in the right place? And we did some looking around. We're like, wait a minute, you know, we need to make sure we're doing the best thing for our child. And we were 100% positive that being at MUSC Children's Hospital was the best place for us.